Hi everyone, Heather here. So if ever there were a group of patients that wanted to do their own thing and not listen to their nurse, that would be my group. Man, this last weekend was exhausting. So I get report on patient number 1, and during the night he's pulling out his IVs and getting up to the bathroom every 1 to 2 hours without using his call light and setting off his bed alarm, and the night nurse is in there trying to help him go to the bathroom, you know, safety so he doesn't fall down, and the patient ends up calling him a thug. Strike one. Well, I was hoping I wouldn't be called a thug, but it's true. He was up every 1 to 2 hours, setting off his bed alarm, and then during the middle of the day I find out that he doesn't have an IV. And he must have been really good at taking it out and washing himself up real good, because I didn't see any blood anywhere. That patient just didn't want any help from us nurses and wanted to do everything himself. So patient number 2, he's kind of a big guy, and he's bedridden and unable to walk because his lower extremities are so massively swollen with fluid, and they're so painful that every time we touch him or move him, he's like yelling. So the night nurse tells me at 3 in the morning, the patient decides he wants to get out of bed. Well, he can't move very well on his own, so he actually does ask for help. And the night nurse is like, oh, no, you can't even walk. We are not going to get you up at 3 in the morning so you can end up on the floor. It's not going to happen. So, since he was up all night fighting with the night nurses, when I came on shift, he was sleeping like a baby for like the first 6 hours. I didn't even want to wake him to give him his meds. Patient number 3. I'll never forget you. The patient who cried wolf. This patient liked to yell really loudly out into the hallway so everybody can hear him. So I come on shift and I hear this, help! And so I go in the room and I'm like, yes, you know, what can I get for you? And he's like, just laying there. I don't like this TV channel. Can you change it? And I was like, all right, but instead of yelling, can you use your call light, please? And he said, oh, okay, sorry. So not much longer after that, I hear this, help! Coming from his room. I don't know if he had his hands up, but that's kind of the way I described it. So I go in there and I'm like, yes, you know, do you need something? And he's like, I spilled Jell-O on my gown. I need a new gown. And I'm like, okay, so what do you do when you need to call for help? And he said, I push this red button here on my call light. And I'm like, yeah, well, why didn't you do it? Oh, because I forgot. Sometimes I forget things. So after 3 days of going through this yelling routine and sometimes using his call light, he decided that he really liked using his call light and he wanted to push it every 10 minutes. Yes, Mr. So-and-so, what can I get for you? Well, the doctor was just in and he said I was doing a lot better and that he would advance my diet. I just wanted to let you know that. Okay, that's great. Yes, Mr. So-and-so, do you need something? Well, I think I should be drinking more fluids. Can I have some lemonade? Sure. Yes. What can I get for you? Well, I think I should be on a regular diet and eating food. Can I have some pretzel sticks? No, Mr. So-and-so, you're on a full liquid diet. And I heard during the night somehow you had gotten your hands on some graham crackers and you threw up, so it's probably not a good idea. 15 minutes later. Can I have some pretzel sticks? No, you can't have pretzel sticks right now. Can I have some pretzel sticks? No, you cannot have any pretzel sticks right now. Yes, Mr. So-and-so, what can I do for you? Well, you know, I would really like somebody to check on me every hour. Well, we would check on you every hour, but you call us into the room every 10 minutes. Strike 3. And patient 4, he didn't even make the cut. But even though I had a day or a weekend, such as that one, I can't really complain because, you know, I got a lunch break and I got out of work on time, and sometimes that's all that matters. I don't really care what happens during the day. Just please give me a lunch break and get me out of work on time, and I'm happy. Well, everyone, thanks for watching. Talk to you soon, okay? Bye!